June is National Men's Health Month, and researchers at Andel Institute have been working to pinpoint the generational health effects a father can pass down to their children. Community Affairs Director Casey Jones learned more about how a pesky summer insect could alter how we view our health.
What we're doing here is these are CO2 pads.
It's not the gear or literature you might expect in a research facility.
Basically see changes in the activity patterns.
Certainly a different kind of buzz for Dr. Heidi Lamprato's team.
So see how these are really close together?
Her lab is full of fruit flies.
And the female is bigger, and then the male has this.
And these Drosophila, as the whitecoats call them, are making Lamprato's work ripe with discovery.
We share actually about 60% of our genes with the fruit fly, which surprises a lot of people. And when you look at genes that we know cause diseases in humans, that it actually goes up to 70 to 75%.
The VAI team is focusing research on the epigenetic implications of generational health, specifically passed down from the father.
You can imagine that the mom has a lot of impact on an organism's development. The mother carries the baby. And so during pregnancy, a lot of things can happen to the mom that can have an impact on the development of the baby inside the womb. But we do know now that dads also bring more to the table than just the genes that they're contributing to the offspring.
Epigenetics looks at how our behaviors and environment can cause changes in how our genes work. Think of it like bookmarks of our health in a library of our genes, pages that the body has marked as points to come back to. Dr. Lamprato hopes that figuring out why leads to disease prevention.
If you and I were born to our parents twice, we would probably turn out differently, even though we have the exact same genome. Where we know now that it's not just the genes that we're getting, so we're getting half of the genome from the mom and half from the dad. We're actually getting more from them, and that contains information about the parent's environment. And that can set us off at a slightly different path.
Several years ago, a study was done on fruit flies, where they gave the dads high, medium, and low levels of sugar. Researchers wanted to learn more about generational effects of obesity.
The offspring of high sugar-fed fathers was more susceptible to obesity. The sons of those flies were born normal, but when we exposed them to high sugar food, which makes flies fat, they became even more fat than a fly that was born to a father that had medium levels of sugar.
Their team uses a completely controlled environment, climate, diet, light cycles, and then they manipulate those settings to study diseases that have increased tremendously in recent years.
We really don't know what's behind those increases. One of them is obesity, Parkinson's disease. We also have a project in autism spectrum disorders. And so the goal in the end is really to, maybe if we find something to intercept, maybe if we find something to prevent that from happening. And so that's why it's so important to find these molecular mechanisms, that we actually have something that we could potentially, turn into a treatment.
Lamprato says we know more now about what parents bring to the table for the next generation's health, and we have underestimated what dads contribute, especially in the months leading up to family planning.
Disease prevention is really where we could, save a lot of money. Like when we don't even get the disease, and I think that's the biggest thing that our science could change.
So obviously some very critical research being done here, especially as we begin Men's Health Month and as we approach summer. Important to keep in mind that we have more in common with fruit flies than we might think. Of course, one thing that we don't share that makes them so efficient for this kind of research is their reproductive cycle. In fact, a fruit fly born today can be a grandparent in just 2 weeks. Keep that in mind. For News 8, I'm Casey Jones, connecting with community.